Hello, my name is Brian. I'm a family nurse practitioner student with Saginaw Valley State University. Going to be doing an assessment on you today involving your peripheral vascular system. So first we're going to inspect your arms. Looking at your arms bilaterally, they are the same size, they're symmetrical. I don't see any swelling. Color is appropriate for your ethnicity. Let me see your hands. I'm just going to look at your nail beds, which are pink, no signs of cyanosis. Vascular structures appear to be similar on both sides. There's no varicose veins noted or any abnormal vascular structures. So then we're going to inspect your legs. Once again, noting the size, they're symmetrical in size. I don't see any edema or any swelling. I'm going to have you, our color is normal for the ethnicity. I don't see any areas of hyperpigmentation in any area of the leg. Your toenails are painted blue, but normally I would assess those as I assess your fingernails, looking for a pink coloration. Looking at hair distribution, your legs are shaved, but it doesn't appear that there are any areas that don't have hair growth, which would be a sign of insufficiency. Then I'm going to have you stand up. Just looking at the front and the back of your legs for any type of varicose veins, and none are present. So I'm going to have you sit back down, and then we're going to move on to palpation. I'm going to see both wrists here, just feeling for your radial pulses. Alright, and then we move on to brachial pulses. Alright, both of those were 2+, even and symmetrical on both sides. Next I'm going to have you bend your arms at a 90-degree angle, and I'm going to feel for your epitrochlear nodes, which are located about 3 centimeters above the corner of the elbow in between the bicep and the tricep. I wasn't able to palpate them on you, but that is a normal finding in healthy individuals. You can't necessarily feel those. Next, I'm going to see your fingernails here again. I'm going to press down, just checking for capillary refill. Refill is under a second, so we're good there, or we're normal, and as long as it is under 3 seconds. All right, we're gonna move on to your lower extremities. I'm gonna put gear move just a little bit. I would put gloves on at this point. I don't have any gloves here, but I'm going to feel for your femoral pulses. And then popliteal. Alright. Dorsal pedis pulse. And posterior tibial pulse. Alright. All of those were 2+, even and symmetrical on both sides. Actually I'll have you lay back once again. I'm going to feel for your inguinal nodes here. So I'm just palpating. Alright. Those were palpable. They were soft, movable, symmetrical on both sides, and there were no firm or hard areas noted. Alright. Next, I'm going to feel for temperature, just using the back of my hands here. Great. symmetrical on both sides. There was no area that were warmer or colder than the other areas. If there was any type of edema noted, I would check it. You press down on bony prominences, usually the shin, and then that's when you determine what kind of edema is present and the grade or level of the edema. Next, I would check for capillary refill on the toes, the toenails. Toenails are painted, but do the same as you do on the fingers, where squeeze, and as long as the color returns within 3 seconds, that's a normal finding. Alright, so we're going to do the Allen test. See one of your arms here. So I want you to squeeze and make a fist. Alright, let go. And I let go of one of the arteries. Alright, color returns briskly. So now I'm going to have you make a fist again. I'm going to let go of the other side. Open up. Alright, color returns briskly, so that's a normal finding. We'll move to the other side, do the same thing. Alright, squeeze, open. Alright, color returns. Open again. And color returns. Alright, next we're going to test for arterial insufficiency in your lower extremity, so I'm going to have you lay back. I'm going to raise your legs to a 60-degree angle. It's about 60. We would hold them here for a minute, and then I would lower them down, and then have you sit up quickly, and then just dangle them. And then to determine if there's an issue or not, as long as color returns within 10 seconds, that's an appropriate finding. And then the vein should refill within 15 seconds is the other thing you're looking for with this test. But I do believe that is it.